Hi, my name is Casey and I'm a registered dietitian with URS Medical. And today I'll be demonstrating how to feed your child using a syringe or a gravity feeding bag. Bolus feeding or syringe feeding is a type of feeding in which you're using a syringe to feed your child through the feeding tube. First, to get started, always make sure you wash your hands and have a clean working space. In order to syringe feed, you're going to need a 60 ml syringe, some water, and your formula or breast milk. First, attach your extension set to the feeding tube and flush with the prescribed amount of water. Remove the plunger from your 60 ml syringe and attach to the feeding tube. Hold the syringe at or above the level of your patient's stomach and go ahead and pour in your formula. Open all the clamps and raise the syringe to make the formula flow faster or slower. Continue to add formula to the syringe until you've given the prescribed amount of formula. When finished, close the clamp on the tube and remove. Finally, flush the tube with the prescribed amount of water. In conclusion, that's how you use a syringe to feed your child through their feeding tube. Next, I'll show you how to use a gravity feeding bag to feed your child. To get started, you're going to need an IV pole, your gravity feeding bag, formula or breast milk, a 60 ml syringe, and some water. Start by closing the roller clamp on the gravity feeding bag and pour the prescribed amount of formula into the bag. Close the bag and hang it on your IV pole. Make sure the drip chamber is 2 to 3 feet above the patient's stomach or feeding tube. Remove the cap from the end of the gravity feeding bag and place it into a container. We'll go ahead and prime the feeding bag by slowly removing the roller clamp up and down till the formula gets to the end of the tubing. We do this to remove the air from the tubing so none of the air ends up in our patient's stomach and makes them uncomfortable when we start the feeding. Using a 60 ml syringe, flush the prescribed amount of water in your feeding tube. Make sure your child is sitting up in a chair and their torso is elevated 30 to 45 degrees during the feeding. Remain in this position for at least 30 minutes after the feeding is over. Attach the end of the gravity feeding bag to your feeding tube and using the roller clamp, move it up or down to make the rate faster or slower. Allow the formula to drip over a period of 30 to 60 minutes. A slower rate will help decrease any signs of intolerance such as nausea, vomiting, and bloating. When the feeding is over, close the roller clamp and disconnect the tubing from the feeding tube. Finally, flush your feeding tube with the prescribed amount of water. Rinse the bag and tubing with warm water in between feedings and make sure to change your bag out every 24 hours. In conclusion, that's how you use a syringe or gravity feeding bag to feed your child through their feeding tube. If you have any further questions or need any help, please reach out to your local representative at URS Medical. Thank you for your time.